Governor. Thank you so much.
We have pens for everyone, but I need to be in Duluth by 6 o'clock, and I wouldn't make it if I needed to use each one of those in turn. But this is a great day for the people of Minnesota. This is a day we're taking a major step forward to improve the quality of health care, the affordability of health care, and to put the people of Minnesota and their interests in charge of our health care system. I want to especially thank Representative Joe Atkins and Senator Tony Laurie, the sponsors of the legislation, the House and the Senate. They did a phenomenal job during the whole process. They can tell you how many committees it's gone through, how swiftly it's moved, and then the conference committee working everything out and getting both bills passed on both the House and Senate floor is really, really outstanding. And I've got a great group of agency heads who have been involved in a cooperative way to make this happen. Commissioner Showalter has been the lead on this, Commissioner Jessen, Commissioner Parnell, Commissioner Rothman, Commissioner Kronk, Commissioner Ellinger, and of course all of these fabulous legislators and many others too who stood up to some of the really exaggerations that were part of this process going back to before the presidential election. It's unfortunate that how we can best provide health care to all the people of Minnesota had to become such a starkly partisan, really ugly matter for the last year. We attempted to defeat the president, and then the Supreme Court challenge, and so. But I think the people of Minnesota and people of this country have spoken. They want better quality health care. They want it more lower costs, and this exchange aims to provide that to them. There are a number of organizations who supported this legislation. I'm going to mention just a few, but I want to thank all of you who have been part of putting this legislation through. Minnesota Medical Association, AARP, the American Cancer Society, American Diabetes Association, Small Business Minnesota, AFSCME, SEIU, and Take Action. Thank you all very much for your support. And now let me ask Representative Atkins and then Senator Laurie to make some comments, and then we'll proceed from there. Thank you very much.
Well, good morning. I was telling the governor and these folks that I literally just had a filling put in at the dentist without Novocaine. Because I was a little afraid. I didn't want to come here and drool all over, but it was actually a little less painful than going through the legislative process. Actually, you know what? In fairness, and I so appreciate my colleagues for being here with us this morning. We had so much help as we went through the process from legislators on both sides of the aisle. Almost half of the bill now was actually drafted by Republicans. I know they didn't sign on to it, Governor, but they did great work in terms of privacy protections and oversight and other matters in the bill, and I still want to thank them whether they voted for it or not. This truly is a landmark day here in Minnesota. This is the most significant reform of health insurance that we have seen in 50 years. It's not simply significant because you can purchase your health insurance from a website and have that added convenience. It's significant because for the first time in Minnesota history, we've put consumers on the same level playing field as the carriers from whom they are purchasing health insurance. Literally, at this point in time, health carriers will have to compete more fiercely than they ever have in the last 50 or 100 years for consumers' business. And that's not something we have ever seen in Minnesota before. That, to me, is the biggest element of reform that we're doing here today. And it'll have a positive impact on lots and lots of Minnesotans. Somewhere in the neighborhood of 1.2 million Minnesotans will be benefited as a result of this, and 300,000 Minnesotans who today do not have insurance are expected to get their insurance, some for the very first time, as a result of the health insurance exchange. I would be remiss if I didn't, in addition to my colleagues, we had so much help as we went through this process from all of the groups that the governor has already identified, members of the public who took the time to come down and testify, the exchange staff who were there at every moment of the 9 hearings in the House and 9 hearings in the Senate. Somebody tallied up it was over 100 hours of legislative time that was spent going through committee, and somewhere in the neighborhood of 365 offered amendments, many of which we took. With that, again, Governor, thank you very much for signing this into law, and I want to turn it over to my good friend and my Senate counterpart, the author of the bill in the Senate, Senator Tony Laurie.
Well, thank you, Representative Atkins. Thank you, Governor Dayton. It was actually pretty emotional watching you sign that bill. This is a really big deal for Minnesota. This is a big deal for our people, for our families, for our small businesses that have struggled to find affordable health care options for the people of Minnesota. This is a Minnesota model where we're working together. It's a good compromise between the House provisions and the Senate provisions that came together. And what we have is an online, phone, or in-person marketplace where people are going to be able to shop and have that competition. The people won on this bill. This bill is going to ensure that the products offered on the exchange are in the interest of consumers. And we've got strong language in here allowing this board to make sure that the products offered are in the interest of consumers. We've got a 7-member board. We know Commissioner Jessen is one of them, and we'll know the other 6 by April 30th. And we trust the governor to appoint a really good mix of consumers and industry experts so that we get this right. We get this right out of the box. On October 1st, people are going to be shopping for their health insurance coverage that will become effective on January 1st of 2014. We have a conflict-free board that's still able to ensure that the policies are in the interest of consumers, but we've ensured strong oversight so that the actions they take are open and transparent and accountable. We're going to make sure that we do that through the Legislative Oversight Committee that's assigned. The Office of the Legislative Auditor has assured us that they will be watching very, very carefully and making sure that this board operates well, and the federal oversight is significant. We're going to be keeping a close eye on this. We'll be returning. One of the things that was said over and over, by me at least, this is just the first step. This is not really true health care reform. This is health insurance reform. It's addressing access to health care. It's addressing some of the affordability issues, but we have significant work left to do, and I believe that we will be able to put our best foot forward and work together in a bipartisan manner to meet some of the additional goals. We have the basic health plan in front of us to put together, and I'm excited about that prospect. I think we can do really well, again, for the people of Minnesota and bring about the triple aims of health care reform, of providing better experiences for individuals in their interactions with our health care system, better population-based health to bring better health to our entire state, and through doing these first 2 aims well, we will meet the triple aim, the third aim, which is reducing the cost curve, finally, and doing a better job. So I'm really excited about this day, and thank you all for coming. This was a big lift, but it was a team lift. I see many of the folks who gave countless hours on the Healthcare Insurance Exchange Task Force, the commissioners, the legislators that helped us through this, the governor, and my good friend Joe Atkins. So thank you very much for coming and being a part of this celebration.
As I said before, we have 6 terrific agency heads who set aside their organizational perspectives to collaborate together and come up with what we thought was the best arrangement among the executive branch agencies. And the person who was first among equals in that endeavor, Jim Scholder. Jim did a phenomenal job. April, working with you, your staffs are just did a superb job. And now the fun part begins, right? You get to do it. But let me ask Commissioner Schroeder to say a few words.
Thank you, Governor. I will be quick in my remarks, but I, too, just want to thank everyone who has helped us get to this point. I want to start with the Governor, because he has kept this opportunity for a state-based exchange alive, made this opportunity available to the legislature, and I need to thank our authors for the fantastic work and all the legislators who got it to this point. But I also want to thank the healthcare and the health exchange task forces who started this conversation in Minnesota, the fantastic health exchange staff, April, everyone who's watched any of the hearings knows what she has brought to the table, but along with that are many other people. I could name them. We're not going to do that today. But they have been fantastic in managing both the policy, the process, the technical work that has been necessary to keep this day alive. But this is just one milestone of making insurance available to people. Nobody's getting their insurance today, unfortunately. We're still working towards this, and this is an important milestone. We still have work to do in naming the board, working through the technical systems and business processes, getting rules and processes out to people. But we also need to introduce the Minnesota insurance marketplace to people as well. Help them understand what is available, how this can make their choices more simple, affordable, and understandable. And so today, we're going to unveil the name for the Minnesota Insurance Exchange. There's a board. Going forward, the Minnesota Insurance Exchange will be known as MNSure, where you get your health coverage. This is a great opportunity to take work of more than 90 people, testing in the marketplace, working with Haberman, and to get a professionally designed and approach to how to help people understand what is available through the exchange. And we're looking forward to introducing the exchange and MNSure to the people of Minnesota.
All right, thank you. Okay, we'll be glad to respond to any questions on this subject, and then afterward we'll open it up.